I'm Lauren Maloney, and welcome back to What Matters This Week. Joining me right now is Laurie Emerson. She is the Executive Director of Nami, and of course, that is the National Alliance on Mental Illness of Vermont. Laurie, thank you so much for being here.
Thank you, Lauren, for inviting me.
I wanted to have you here. Today's May 1st. We're going to start talking about Mental Health Awareness Month. And it's so important to shed even more light on this when it comes to this month and 12 months of the year. But the theme for May is Together for Mental Health. Can you explain how that encompasses your point and your message here?
Absolutely. You know, with the pandemic, we've all been challenged with our mental health, and being able to connect with one another and support one another has really helped people heal and be able to get back together and support one another.
1 in 6 young people in this country experience a mental health condition each year. Only half of them receive treatment. We understood that this was such a problem at the beginning of the pandemic, and emergency rooms were getting filled. It was really tough for young people and teens to get the care when they needed it. Have we made any inroads and improvements there?
We're really challenged. When it comes to people getting help early, we need to intervene much earlier than what we are, so it doesn't get to the point where children or adults are waiting in the emergency room. Our resources in the community need to expand. Our workforce is being challenged everywhere, especially in mental health. And the funding for mental health needs to improve as well. We need that parity. We need people to look at mental health at the same level as they do with physical health.
Am I hearing that we're not there yet, that they're not on the same level yet?
No, unfortunately not. And, being able to have that integration with physical health and mental health is just so very important, because a lot of times people are going to their primary care doctors, having them be able to identify where there's a need, where somebody might need more intervention, can happen at the primary care level, and then making referrals out to people. And, also being able to have more of those resources here, like an urgent care model. Families need to be able to bring their loved ones to a place where they can get immediate care. Going to the emergency room, they're not getting the treatment that they need. And if we can establish more community resources, we can help people when they need help.
Instead of, as you alluded to, instead of using, the emergency room as that last resort and hopefully getting help earlier, is there better connections within schools, within high schools, middle schools for these young people? Are school nurses getting the training they need to be aware of some of these conditions and issues?
That's the opportune time, because kids spend a lot of time in school. And, Nami Vermont has a program called Nami Ending the Silence, where we're going into schools. We're helping the students to get the education that they need to identify, mental health concerns, how to ask a friend for help, and being able to have students help support one another is ideal. We all need to be there together for one another to be able to help each other. And also being there to provide all of our free training to nurses, to the school teachers, and really the community at large. We're able to offer any of our presentations to help people understand what it means to live with mental illness.
Perfect segue, Laurie. What different ways is NAMI offering help this month?
We have support groups that help people who may have a mental health condition. We have support groups for family members who need to talk with other people who have been there. And all of our support groups are peer-led and are available several times a week. They're all virtual right now because of the pandemic. And we have a conference coming up. So we provide that education. We provide information. We have a family-to-family class that families have gone to. It's an 8-week course. And the information they get and the networks they build and understanding of the resources really helps their loved one, as well as themselves with their own well-being and care.
Is there a story, an instance, an example where the voices of those who have been through an experience and are now thriving and helping others have really helped that person that at that moment was struggling?
Oh, absolutely. You know, that reminds me of one of our programs we have called Nami in Our Own Voice, where two people in recovery share their story of what it means to live with mental illness, about what has helped them, and the next steps that they're taking in their recovery. You know, so many people find Nami Vermont and are able to then volunteer for us and give back to the community, which helps in their own healing process in their recovery.
For sure. I came across a statistic, Laurie. 60% of Americans are concerned about the stigma around mental illness. Why, after everything we've been through, why is that number still so high?
You know, I think that, you know, there's stigma with the community, and then there's the self-stigma that people have. And, you know, it takes other role models to come out and talk about their own mental health, that people understand that they're just like anybody else, that anybody's mental health can be affected. And I think the more we can keep getting that message out there, we're able to let people know it's okay to talk about it. It's okay to talk about your mental health, because once you can create that culture, that's where a lot of the healing starts. And being able to talk with your own family member openly, without judgment, that's what helps people.
I feel like we tend to talk about the negative things that the pandemic may have shed a light on, and we know mental health is one of them. But I wonder, in that process of where we are now, what good has come out of it? What light have you seen as a result of what we've been through?
You know, we've really seen a focus on people's mental health and letting people know that it's okay to talk about it. And, you know, the more you can open up that door and let people know that it's okay to talk about it, we're going to have less suicides. We're going to have more of an opportunity to really just have a dialogue about it. That, you know, there shouldn't be this stigma about our mental health. And it goes hand in hand with our physical health, because anything that affects you physically can affect you mentally, and vice versa.
You made a good point to me before we started today, basically saying that the pandemic did make us realize that we all, you know, have to focus on our mental health in some way, however that may be. And are you finding that is the case with just about everybody that you speak to?
Everybody. You know, we've all been affected by isolation, loneliness. You know, our social networks have changed. We've all been in isolation. Anxiety, depression has increased. And, you know, getting back to those basics, being able to socialize with other people is so very important, to be able to help us connect with one another. And it's all about connection. And when you lose that social connection, you feel that loneliness, you feel that anxiety. So we need to get back to those basics. And even with kids, you know, having sports, having school, having those friendships, and not just focusing internally and using computers all the time or our phones all the time. We need to get back face to face.
Laurie, you know, final word, is there a message that you would send out to our viewers, young, old, in between, when it comes to this topic?
What I would say to people is, you're not alone. that there are so many other people that understand what you're going through. There are so many resources out there for you to take advantage of. And you can call Nami Vermont, you can call any of the designated agencies or crisis lines to be able to just talk with somebody, and somebody who understands and can validate what you're going through. And that's one of the things that Nami Vermont does really well, is we are all people with that lived experience, and we are here for you.
Laurie Emerson, I really appreciate it. Thank you so much.
Thank you.